Before we start, I just want to go over a couple of housekeeping items for us. You'll see on the screen, if you would like to listen to the webinar in either French, Arabic, Spanish, please go to the globe on the bottom of your screen, and then you can select your language of choice. Another item I just want to review is our Q&A and how we're going to handle questions today. There will be a Q&A session during about midway through our time together. So if you have questions, I encourage you to put them into the Q&A box, and then they will be answered either, we will have people monitoring the Q&A box as we're going along, and if it's something they can answer easily there, they will go ahead and do that. And if not, we will look to take it up during that time we have for Q&A. I'd also encourage you to use the chat box for anything else. So if you would like to introduce yourself, just let us know who you are, where you are based, and who you are with. That would be great. Another thing, just we're going to keep your videos off and on mute as well as we proceed, just to help with the bandwidth issues, as we expect to have several people joining us today. Next slide, please. So welcome everybody to our official launch of the Global Nutrition Cluster Technical Alliance. My name is Colleen Emery, and I'm going to be one of your hosts for our time together. We have a fantastic lineup of people to share with us today about the Alliance. And our goal today is to provide you with a broad stroke of what the Alliance is and the services we can provide. So without further ado, because we do have a packed agenda, I'd like to hand our speaking over to Victor to open us up today. Thank you, Victor.
Hi, Colleen, and I want to make sure that you can hear me well. I want to check that the sound is right.
Yes, Victor, you're loud and clear. Thanks.
Thank you so much. Dear colleagues and friends, greetings from UNICEF headquarters in New York. I'm extremely pleased to be with all of you today. We believe, I'm sure that we all believe around the table, that nutrition is the right of every single child. And today, I would say that the need for diets, services, and practices that protect, promote, and support good nutrition for children has never been greater. Since the year 2000, we have achieved remarkable progress on nutrition. And I always like to start with a very positive note. Since the year 2000, we have reduced the prevalence of stunting in children by 1/3, and the number of children who are stunted by 55 million. This is a remarkable achievement that we all need to celebrate. This achievement proves that positive change for nutrition is possible and actually is happening at scale. But there is more work to be done. There is more work to be done as indicated by the very slow progress in reducing child wasting and the increasing numbers of children who are overweight or obese, including in sub-Saharan Africa. So yes, we need to acknowledge that the face of child malnutrition is changing. On the one hand, globalization and urbanization are changing the way families feed themselves and feed their children. On the other hand, climate change and inequities are making healthy diets unaffordable for millions of families and millions of children. And finally, humanitarian crises and health pandemics threaten to reverse some of the major gains that we have achieved over the last couple of decades. So yes, the reality of child nutrition is changing, and so is the complexity of the humanitarian crisis. With these changes, new questions come to us, new questions emerge, questions that cannot wait because lives, sometimes thousands of lives, are at stake. The COVID-19 pandemic has changed the way we approach many things, and nutrition is no exception to it. In the last few months, we have seen an acceleration in the demand for better responses to complex nutrition questions. From tracking violations of the code of marketing of breast milk substitutes during quarantines and lockdowns, to the provision of socially distanced nutrition services for children, adolescents, and women, or the simplification of treatment protocols for children who suffer from wasting. Meeting these and many other questions requires the best answers to come to the fore. There is no doubt in my mind that we need the best knowledge, the best evidence, the best ideas. We also need the best people and the best organizations to help us collectively design and redesign our emergency response. And it is against this backdrop that today I am extremely pleased to launch the Global Nutrition Cluster Technical Alliance. As the cluster lead agency for nutrition, UNICEF understands the importance of timely and quality technical support to frontline responders. The Alliance brings together key technical support platforms, groups, and teams under a single global tent. Practitioners across the world can now access some of the best informed nutrition support through a single email or message, no matter where they are, no matter who they work for. This simplified and transparent system will reduce complexity and will ensure that practitioners across the world get the support they need at the time they need it. My final point, and potentially the most important one, is that the Alliance at its heart is a collaboration. Collaboration between people and organizations working towards better nutrition responses in emergencies. Our community, the Nutrition in Emergencies community, is passionate, is committed, and sometimes uncompromising. The Alliance offers a unique opportunity for change, but only if we nurture the trust and collaboration that lies at its core. UNICEF is committed as cluster lead agency for nutrition. We are committed to lead global discussions, and we are committed to invest in this collaboration. And to succeed, we need all of you to see the Alliance for what it is, an opportunity for us collectively to do better as a community, to prioritize our efforts and to pull together in a common direction. I thank you in advance for your commitment to our collective success, and I look forward to this discussion today.
Thank you so much, Victor. My name is Megan Gayfin. I'm a nutrition advisor at UNICEF and I co-lead the Alliance. I now have a few short minutes to give you an overview of the Alliance, why it was created, how it is structured, and most importantly, what services it offers. I will be brief as our speakers today will be walking you through real examples of the Alliance providing technical support. Next slide. The Alliance was created so that practitioners the world over can access high quality nutrition technical support, no matter who they are or where they're working. Our challenge in the past was that technical questions needed to be addressed to different experts in a variety of organizations. This led to inefficiencies and confusion for practitioners on the ground. The Alliance solves this problem by creating a simple and predictable way for practitioners to receive answers to their questions or to request in-depth support. You may be familiar with the GTAM, which was the first iteration created back in 2018. We learned a lot from the GTAM and have taken this learning both into the redesign and the rebranding of the Alliance. So why change the name? We decided that the GNC Technical Alliance better reflected the relationship with the GNC and the spirit of collaboration amongst GNC partners to deliver quality technical support. Next slide. The services that the Alliance offers to practitioners are focused on meeting the different technical needs we face before, during, and after a nutrition response. Firstly, we can connect you to existing nutrition resources or guidance. We know that there is an enormous amount of resources in our sector, so through our website and our help desk, we can make it easy for you to find what you need. Next, we can answer questions. You can post a question on our website and the Alliance team will respond. If there isn't a quick answer, we can escalate the question to our Global Thematic Working Groups. There'll be more on this in a moment. The next area is comprehensive technical support. You may need support for weeks or for months, and our nutrition advisors can deploy either remotely or in country. The next service is development of stopgap guidance when there is a new issue and guidance doesn't yet exist. And finally, the Alliance has a role in monitoring what the technical issues and needs are at country level all across the world and developing learning products to strengthen capacity across the sector. It's important to note that these services are free to everyone, except for some of the longer term support, but we will discuss this with you at the point of your request. Next slide. Now just a few words on how we are structured. The Alliance is led by UNICEF and World Vision. We are supported by a leadership team that includes the Emergency Nutrition Network, the GNC Coordination Team, and International Medical Corps. It's important to note that the Alliance also includes you, the nutrition cluster partners, academia, and other actors working in nutrition and other related sectors. The Alliance is structured by three main areas: thought leadership, technical support, and knowledge management. For knowledge management, we are investing in people and systems to promote learning and create knowledge, while at the same time informing how we continuously improve how the Alliance functions. Next slide, please. Our forward-facing area of work is our technical support team, a diverse group of nutrition specialists on standby to support in all technical areas. The design of the technical support team is based on our intention to make it as easy as possible for you to access support in all its forms. You just need to ask a question to one place and we will connect you with the best person to meet your needs. Next slide. This slide shows the different people who make up our wonderful technical support team. Many of you will be familiar with the Technical Rapid Response Team that has been supporting countries with nutrition deployment since 2015. The Tech RRT is now part of the technical support team, bringing their knowledge and experience to the Alliance. Joining them are our UNICEF Emergency Response Team advisors, Alliance partner staff, plus other nutrition consultants that have been through our vetting process. Complementing these positions are the technical resources managed by the GNC coordination team, which include the different help desks and the rapid response team for coordination and information management. Next slide. In my final slide, I will introduce you to the thought leadership workstream. Under this workstream, we have the Global Thematic Working Groups. The main function of these working groups is to come together to develop guidance when there is a gap. But they are also expert groups who can debate difficult questions and make recommendations for program and contextual adaptations. There are currently 3 working groups and a 4th is under development for cash for nutrition outcomes. Each working group has several sub-working groups that can be activated for specific tasks. The working groups are intended to be flexible and can be created and stood down based on need. If you are interested to join one of these working groups, there'll be information on the website about how you can express your interest. Okay, my time is up now and I'll be handing over to Yara to give you an example of actually what happens when you ask a question to the Alliance. And if you're interested in more details, we now have a strategic intent document for the period of 2020 to 2023 up on our website. Over to you, Yara.
Thanks, Megan. Hi, everyone. This is Yara Sfair. I'm a help desk for nutrition in emergencies. I work with UNICEF. I'm also part of the Global Nutrition Cluster Technical Alliance technical support team, as Megan was showing you. I want to talk very briefly today about the role of the help desk and give you examples of how the help desk can support you. And also finally show you how a help desk can also link your request or your question to the arm of the Global Nutrition Cluster Technical Alliance, the thought leadership who are looking at the different questions. So basically the Global Thematic Working Group as Megan was showing you. So next slide, please. Thank you. So what is the role of the help desk? The help desk is to provide orientation, information, and support in relation to the nutrition response in emergencies. So it can be a support that is provided to cluster coordinators, to nutrition cluster partners. It can also be nutrition practitioners in the field. We are a number of help desks that are focusing on different areas, and the areas are coordination, information management, nutrition information systems, and nutrition in emergencies, to name a few. You can access the support of the help desk by simply clicking on the request support button on the Global Nutrition Cluster Alliance website, and you have to fill a short contact form and we will receive your request. So as the Global Nutrition Cluster Technical Alliance colleagues say it, there are no silly questions, so please don't hesitate to reach out. The next slide, please. So an example of a recurrent request from cluster coordinators and partners in 2018 was basically to have TORs for the technical working groups that are formed in country. So as you know, when partners come together to form a cluster, sometimes they need to focus on a certain area and discuss it in a smaller group to bring it back to the bigger group and with more details and unpack it. So those technical working groups needed generic terms of references so that they can hit the ground running while they want to be formed. So this is an example of a support that was provided. The help desks did put together terms of references for those groups. For example, infant and young child feeding in emergencies or nutrition information systems technical working groups, but also help developed as well certain tools to assess the performance of the coordination or the nutrition response. At the onset of the COVID-19 pandemic, there was also TORs that were developed to form groups in countries so that these groups can look at how to adapt the nutrition response in facing the pandemic, COVID-19 pandemic. So next slide, please. Okay, oftentimes we receive a question that is a little bit more complicated to answer. So for example, here's a question from the cluster coordination partners in Nigeria who are looking for guidance on conducting a mortality audit in stabilization centers. So in this case, they were looking for a how-to or a guidance, but they were also looking at examples from other countries. So as no commonly used tools are available to conduct a mortality audit, we thought to, next slide, bring it to the attention of the Global Thematic Working Group, which is also under the Global Nutrition Cluster Technical Alliance, and ask the colleagues that are working in this group for either an interim guidance or for their informal suggestions. Next slide, please. Okay. There's also the possibility to facilitate posting the question on the ENNet platform. Obviously, the user doesn't need the help desk to help post the question on ENNet platform, but sometimes we can remind the person asking or the collective group that is asking that this is something that they can do, so to bring it to the attention of the collective. Next slide, please. So in a nutshell, when a user or you request support through the website, the technical support team receives the request and either answers the request by developing a tool or by looking at the guidelines, available updated guidelines, and providing a response. Or if the answer is not present in commonly used guidelines, then this question can be brought to the attention of a global thematic working group that were created under the Global Nutrition Cluster Technical Alliance in the last years. There's also the option, if you need more long-term support, that you receive remote or in-country support. But I wouldn't like to go into that example because this is exactly what Khalil will be talking to you about in just a minute. So that is all for me, and thank you. Khalil, over to you.
Hello, everyone. On behalf of the DRC team, my name is Khalil Sagno, Nutrition Cluster Coordinator. I'm here with Dr. Bruno Bindaba, Nutrition Program Director from the Ministry of Health. And we prepare for you a few slide to show you how Alliance supported the nutrition response in DRC in the last three years, I would say. Slide. Three main domain was supported by slide. Three main domain was supported by different mechanisms of Alliance. Slide. Just in slide. Slide, it look like the slide is not moved. Okay. Just in slide.
It's on the IYCFE from theory to practice slide.
Okay. Can you hear me?
Yes, Khalil, we can hear you. And as was just said by Justine, the slide that we are seeing on our side is the IYCFE from theory to practice. Oh, I think, unfortunately, we've lost Khalil. I believe he's dropped. Well, we tried to get Khalil back online. How about we move to Tanya? If you can share with us about the COVID-19 related activities, and then while that presentation is going on, we'll work on getting our DRC colleagues back with us. Okay?
Sure, no problem. So I'm Tanya, one of the technical directors from the Emergency Nutrition Network, and I'm just going to take us through a few reflections on how the Alliance responded to the COVID-19 pandemic this year in order to support actors on the ground. Next slide, please. So there were different elements to this response, all of which are linked to each other. Firstly, there was the direct support, that was the answering of questions that came from the field by the help desk, the technical team, also deployments, then capturing outstanding questions that were difficult to answer and raising those to the collective. And where required, feeding that through to guidance, interim guidance that was being developed, given the urgency of some of the questions that were coming up. And then finally capturing experiences on the ground so that others could learn from them. And I'll go through each in a bit more detail now. Next slide, please. In terms of direct support to actors on the ground, support was provided to over 10 different country teams for adapting the collective nutrition response plans or preparedness plans to COVID-19. Some existing support that was going on already was also adapted to address the new needs that were presented by COVID-19. And then some additional, more in-depth technical support in specific thematic areas was given to a number of countries. Next slide, please. The second area of response was to capture some of the more tricky or outstanding questions. And those questions were coming in through ENNET, where people can post questions for support from peers, for answers by peers. We quickly got a button up on the Global Nutrition Cluster website so that people could also ask questions through that. And then of course, questions were coming in through the help desks. And what we did was consolidate those questions where there weren't clear answers to take them to the COVID-19 coordination calls. As you can see, there were a range of themes that these questions came under. There were a lot of questions around wasting prevention and management, and also quite a large proportion of questions on infant and young child feeding, and a number of cross-cutting issues that were, for example, questions like, around supply chain would be an example of that. And many of those questions were highlighted at that level so that guidance that was under development could be sure to speak to them. Next slide, please. So a number of different pieces of rapid interim guidance were developed, either by Global Thematic Working Groups or Global Thematic Working Groups fed into the development of these different pieces of guidance. And a review was done by the GNC of some of these pieces of guidance earlier this year. And the results are here that show that the majority, the question that was asked, sorry, of different clusters at country level was whether they were aware of the guidance and whether they were using it. And what you can see from the results is that the majority of country clusters were actually able to use those different pieces of guidance that spanned themes around child wasting, nutrition information systems, and infant and young child feeding. Next slide, please. It became clear as we moved into the end of April, May, that actually as the guidance, different pieces of guidance came out, the outstanding questions that were coming up from the field were less around technical issues and more around the need to understand different experiences of adapting programs and what was being tried at country level. So a form went up on the GNC website to try and collect those experiences under a number of thematic areas, and examples were put together by teams of experts so that there would be examples of different adaptations that partners could look up and access details on and find examples and tools. Next slide. In terms of capturing field experiences and program adaptations so that others could learn from them in relation to the COVID-19 response, a number of webinars were also held in multiple languages so that different experiences could be shared. Next slide, please. And also a number of podcasts were developed that contain interviews with different country level actors, but also dealt with some of the more global level issues such as supply chain. All these resources and materials are available via the GNC Alliance website. Next slide, please. We will be doing a more in-depth learning piece next year, documenting what was done in relation to COVID-19, what worked and what improvements could be made when we're looking more into the long term now. But I wanted to finish just with a huge thank you for what was truly a collective effort to all of those who posed questions, who input into guidance, and who shared their experiences of adapting programs on the ground, and who participated in the different webinars and podcasts.
Thank you very much, Tanya.
We now have
back to DRC. Yes, Khalil, we will return to you. I think you've been able to reconnect, thankfully.
Okay. Hello, everyone. I'm sorry for internet issue just recently. And on behalf of the DRC team, my name is Khalil Sagno, Nutrition Cluster Coordinator. I'm here with Dr. Bruno Bindaba, Nutrition Program Director from the Ministry of Health. I was saying that our support, concrete support that we receive in the last 3 years was concerning 3 main domains. The first was the scale-up of IYCF programming and improving coverage of waste in treatment. These two support we received from technical rapid response team. And the last one, the third, which was strengthening nutrition cluster performance itself, was mainly conducted by GNC help desk. So for some details, next slide, please. For some details linked to those support that we received in the last 3 years, you can see in this slide concerning the IYCF, we moved from the theory to the practice in terms of implementing. So when we made the analysis in 2018, we realized that in the country we have a limited IYCF capacity, but also none of the humanitarian response plan from the beginning of the crisis in DRC till 2018 never integrated IYCF, while this intervention is a key for save life of children in the humanitarian context. That's why we discuss and we get support and deployment from technical rapid response team. First, it was in 2018 to support us to finalize the IYCFE strategic document, but also try to train the partners at the country level. But also in 2019, 2020, we received an expertise coming again from technical rapid response on IYCF, but in the specific context of Ebola, which allow us to make the review of breast milk substitute management for Ebola cases and development of a mechanism for safer BMS management. All these two supports allow us to actually integrate effectively IYCF in the humanitarian response in last year and this year. And also we were able at the country level to train more than 100 people in terms of IYCF actually. What it gives us as a result, a key result at the moment is what you can see now in the slide, this slide. In the specific context of Ebola, we were able to reach more than 3,000 children less than 2 years in terms of IYCF specific interventions, but also more than 92 pregnant and lactating women counseled in terms of IYCF in the context of Ebola. Outside the context of Ebola, we were also able with WFP, with UNICEF to make sure that we sensitize more than 400,000 pregnant women. So the second one is the support that we receive from technical rapid response. Is next slide. Is about how to improve the coverage in terms of waste in treatment. And as again, in this slide, you can see from 2006 to 2019, we'll never be able to exceed 30% of wasted children receive treatment at the country level, despite the investment for the stakeholders. That's why, again, we discussed with technical rapid response team to get a consultation of the stakeholders at the country, and we come out with to train 32 people in July in terms of simplified approaches. And tool was developed in terms of strategical, but also operational tool was developed. But for DRC typical context, what we choose as a simplified approach was the three main things: the community management of the acute malnutrition cases, use of one product for treatment of SAM and MAM, and also use of MUAC and EDAMA as a criteria to the selection or to the inclusion of the children, and also for the monitoring. And actually, UNICEF has mobilized funds to implement these simplified approaches in 2 health zones. We didn't have the result yet because it did not start yet, but we will be able to conclude next year, and probably we'll try, the conclusion will try to make some revision in terms of CMAM protocol in DRC. Next slide. The last one, domain wherein we receive support from GNC help desk, it was strengthening the cluster performance itself. And again, as you can see in this slide, when we make a CCPM, cluster coordination performance monitoring in 2018, it was reported that 70% of cluster function were satisfactory or good. That's why we, with the support coming from GNC Help Desk, we deployed the IEM, we trained the coordinator at the subnational level with GNC Help Desk, and we were able at the country level to continue the training for the nutrition partners. And finally, when we did the cluster coordination performance monitoring in 2019, we realized all the function was either satisfactory or good. We would like to continue this thing at the subnational level because this was national level slide. The last slide is where you can see, the last slide is just to tell you women in DRC was telling us to tell you GNC thanks because what was done to support nutrition response in DRC allowed them to access to the key nutrition services. And I could not end my speech without saying that on behalf of the million of children and women in DRC. Thanks.
Khalil, thank you very, very much for sharing with us all that you did there. Now we're going to move to a Q&A session. So, and that's going to be facilitated by Andy and Ben. So over to you, Andy and Ben.
Thank you, Colleen.
Thank you, Colleen. Hi, Ben. Okay. Do you want to start off with the questions?
Sure. Well, before I do that, can I invite all of us to turn their videos on, please? That would be great. So thank you very much, everybody. We have got loads of questions. We're not going to go through them all, but we will try our best. So I'm going to kick off with one question from Emily Hockenhull, who has asked about localization. And she says, as many of us are moving towards a localization, would you be able to explain how the Alliance is supporting the localization agenda? So who would like to take that one? Megan, are you happy to?
Yeah, absolutely. Thank you, Ben, and thank you for the question. This is really, it's a really important conversation within the Alliance at the moment. What we agree on is that we are here to support practitioners who need support. So we know that some of the technical support needs of practitioners who are working in local and national organizations may be different to those who are working in kind of larger or international organizations. So we're giving a lot of thought at the moment to how we can make the Alliance as accessible to these practitioners as possible. So there's still a lot of work to be done in this space, but it is one of our key objectives. Also to add, we're also thinking through how we provide technical support in terms of remote and in-country deployments. What we are aiming to move towards is a model where we utilize, when there is a request for a deployment, that we utilize all of the, what we know is super strong capacity at country and regional level as a priority. So we're working on different mechanisms, but watch this space. Thanks, Ben.
Awesome. Thanks, Megan. Moving straight on. I know this wasn't how it was meant to be, but I'm going to ask one of the Q&A facilitators a question, if you don't mind, Andy, because I think this is best for you. It comes from Yvette. Hello, Yvette. She says, can the support from the technical support provided in Spanish, for example, for deployable advisors? Maybe we can also add other non-English languages on there as well. And her second part of her question, can deployable advisors work on different topics, e.g. IYCFE and nutrition coordination?
Great, okay. Thank you, Yvette, for your question. We we have various advisors with different language skills within the team, but we also have the ability to reach out to partner organizations, alliance partner organizations who are interested to provide support, and they have different language skills at their fingertips. And if those two sort of first two tier ways to support are not able to provide anybody, we also have consultant rosters that we draw on, which have people from all over the world with all different language capabilities, and consultants can be hired on when needed, or directly hired by the requester, if that is the desired way to go forward. Okay, Ben, I'm not sure if I answered both parts of the question. Can you repeat what the second part was, please?
Second part was more about technical, the breadth of technical expertise available.
Okay, as I explained with the languages, it's the same for technical skill sets. We have the commonly requested skill sets are available as full-time advisors within our team. But we have the alliance partners, which many of the attendees today are coming from, that have a even wider range of skill sets within nutrition and emergencies that can be called upon. And again, where we are not able to find the right skill sets, there are the rosters that we can go to, and hiring consultants is a possibility. So any request is welcome, and we do our best to find the solution that fits your needs.
Thank you, Andy. I'm just going to take this opportunity to say thank you to everyone who's asked questions about specific countries. We will get back to you, but we're not going to respond to them now, but we will definitely follow up with those individuals and any other outstanding questions. Andy, I've got another one, unless you would like, if you've got one.
No,
okay, great. So I'm gonna fudge a couple of questions together here. One from Alex Rivera and one from Ella Rogers. Alex writes about accessibility. How are we making this platform more accessible through languages, for example? And also, I think accessibility refers to cost as well. And Eleanor writes, how much does this cost to get support? Maybe I can ask Colleen, are you able to take that one?
Ben, can you repeat that for me, please?
So it's what one was from Alex about accessibility and languages. And he's already mentioned languages related to the experts itself. And I'm going to add on a bit about accessibility, but related to cost. So, yeah.
Sure. Yeah, so as was mentioned in what was shared earlier in the presentations, we don't want cost to be a barrier to accessing support within the Alliance. So we do have a variety of options available, kind of going from one end to the other. One end being that the support could be paid for completely by the Alliance. We do have some budget available to provide that support, or it could be a cost sharing arrangement. For example, if you had requested an advisor to be deployed for a period of time, then there could be, a cost sharing arrangement put together. But the idea is that we really don't want, as I mentioned, that to be a barrier. So we would encourage you to come to the Alliance with your need, and we can discuss what, best how we can address that and what the cost options are available.
Thank you very much, Colleen. And also to respond to someone's question, I forget who it was, apologies, in relation to how we are funded. We will be showing the donors that who we are very grateful of for funding our activities before the end of the webinar. Okay then, and
I'm happy to highlight a question then.
Go ahead, please.
Okay, there's been a question, apologies, not knowing exactly where it was because I've gone down since then. A question about, is it that organizations need to join the Alliance, or how do they become a part of the Alliance? I would like to direct that question to either Colleen or to Megan, whichever one of you would like to answer.
I can take that on.
Megan. Go ahead.
Thanks. Thanks, Andy. So to be a partner of the Alliance, it's similar to the Global Nutrition Cluster. So we don't have any criteria for becoming a partner of the Alliance. We encourage you to reach out to participate, but it is a very broad inclusion. So I think our strength as the Alliance comes from our partners and having the broadest representation and participation as possible across the sector. In our strategic intent document, we have articulated our Alliance partners, but then also our strategic partners as well. So we recognize that we work in a really diverse landscape of actors, and we really need to work together. So I think a question that comes up a lot is around how do we work with our development colleagues. So we are forming strategic partnerships and linkages with other organizations so that if a request for support comes to us that we realize it's not within the Alliance's remit, that we have a relationship that's ready to be able to refer that request. And we would expect that vice versa as well.
And maybe I'll just add to that, if I may, in terms of how you can engage, there are a variety of ways that if you are interested in participating in the Alliance. For example, we have under the technical support team, as you saw in the presentation, there is a group of advisors that are available to support. But we also have reached out to our Alliance partners, and we have other agencies that said, you know what, I have an advisor in this area of expertise, and I'm willing to provide support to the Alliance. So if, just to say that's one way, or if you wanted to join one of the global working groups, that would be another way that you can engage. So just to say there are, you know, we can look at what your needs are and where you would like to engage and certainly fit you in.
Great, thank you for answering that, Colleen and Megan. Ben, looks like you're wanting to jump in with the next question.
Yeah, I've got two questions. It's a bit of an overlap with the previous one, but I think it's worth, there's no issue, I think, because it's an important point. The question is from Liban Aden. Thank you very much for your question. From Waro in Somalia. Does the Alliance allow us making capacity buildings for local NGOs? And I believe there was another question about who can request support. So maybe we can answer both of those at the same time. Megan.
Thanks, Ben. I did type a short answer to this question, but I mean, the short answer is everyone can request support from the Alliance. And we really welcome you to reach out. If you're not sure, just reach out and we can have a conversation or respond to a message. That's no problem at all. We particularly welcome you to reach out if you are from a local or a national organization. Thanks, Ben.
Great. Andy, Colleen, how much time have we got left?
You have 2 minutes, if you would like them.
Yeah, we have plenty of questions that have come in.
Can I just say that I saw some of the questions can actually be, you can go on the website, click on access request support and actually ask your questions and we will answer you through that, because I've seen like some questions are coming from countries and even from some regions, so that these would be really excellent questions to ask us, for example, through the website.
Thank you, Yara. That's really an important point, and actually one that I was heading towards is I see lots of technical questions that are actually coming through, and questions about our opinion on different things. We are more than happy to answer those through the request support button. There's one in particular here from Hussam Alham, where he or she, apologies, is it possible for the Alliance to share us technical tools and guidelines used to implement the nutrition activities in order to support our programs technically and properly, particularly in case we want to implement a new nutrition project to serve the targeted communities through community health workers? I raised this question. I'm going to actually pass it over to Tanya to explain maybe a little, well, maybe Yara and Tanya, maybe Yara first to explain how maybe you would go about answering that kind of question and where there may be some development there.
We are at the end of our Q&A time, Andy, so if Yara and Tanya want to make a very short interjection on that, but I'm sorry to cut you off, to be the one to have to do that, sorry.
Andy, I couldn't hear you well, so I don't know if Tanya, you want to respond to that.
I think, Andy, what you were looking for is just to, when a question like that comes in, there might be answers from existing guidance or tools that the help desk and the technical support team would be able to answer with. If there was a gap in that those tools or that guidance wasn't available, then we would take that to a relevant global thematic working group to see if they could come together to answer that question.
Great, thank you, Tanya. Apologies if you couldn't hear me well. And I think that brings us to the end of the Q&A. Ben, did you have anything last to say before handing back over to Colleen?
Oh, that's it, thank you. Just go to the website and request support.
Thanks, Ben. That's a very good segue. I'll ask just the slides to get popped back up here again. We're just going to take a minute or two to point you to the website. If we had more time, I would have shared my screen and walked us through a little bit, but we're not going to do that now, but I do have some slides here to show you what the platform looks like. So where can you find us? If you go to this URL, this is where you'll land. And you can see everyone's been talking about this orange button. So this is where you go if you are looking to ask a question or if you have a specific need for technical support, hit this button and then next slide, please. It takes you to this ask a question page and this contact form. So this is the form that you need to fill in order to get in touch with the Technical Alliance team. And it asks you for some basic information. The idea is we want to make it simple to contact us. So we're not asking you for a lot, just some basic information about who you are, how we can reach you, where you're based, if you can describe what your need is or your question is and provide just a short information about what your need is. And then you hit enter and it goes to our team and someone from the Technical Alliance will be back in touch with you to either if it's something that they can answer straight away or provide you with a technical resource, they will do that. If it's something that needs a little bit more dialogue and back and forth, they will do that as well. I also want to point out that there is, on our website, there is a technical advice tab, and you can go here to find the latest technical resources that the Alliance has put out and partners have put out. And we also will have answers to questions that the Alliance has already answered will be posted there. So for example, you will see if we've answered issues on wasting or IYCF, there'll be a short summary of what the question was and what the answer was. And the idea of this feature is to be able to share our answers and share our knowledge across the broader community. Because I think a lot of times we all have maybe, perhaps an issue will come up in various places, but we can go here and see, hey, has this been answered before? But yeah, just to say, it's a very quick process to access us. So I encourage you to go to the website, to hit that orange button, and to yeah, to fill in this information here. And it's as easy as that. So now I am going to pass over to my colleague Dan to share some final thoughts with us before we wrap up today. So Dan Irvan, over to you. Thanks.
Thank you, Colleen. Warm greetings, everybody. My name is Dan Irvin. I'm the Senior Director for Health and Nutrition at World Vision International. It's wonderful to see all of the participants on this call today. I think at the peak we had 354, and coming from all over the world, from Venezuela to Mali to Yemen to Indonesia. It's very exciting, actually. I'd like to thank all of the speakers also for your very clear and instructive presentations. I think it's just been excellent. To start, what is amazing today to me is that we are realizing an aspiration that has been discussed for really the past decade within the Global Nutrition Cluster. The Technical Alliance is a proactive and tangible investment into the nutrition human resource gap we've all long struggled with. In this regard, I am particularly pleased with the emphasis on capacity building for field practitioners. That stands to not only meet urgent needs, but help also to establish longer-term capacities that are much needed. One of the participants, Dr. Partne from India, in the chat box wrote, "The Alliance is the need of this hour." And I couldn't agree more. I know I needn't point out to this audience the timeliness of this investment, but our global context today certainly underscores the growing need for nutrition emergency response capacity. These are extraordinary and very strange times we're living in. This year's SOPHI report noted that 750 million people are severely food insecure, and that unfortunately, this is an upward trend. The COVID pandemic is exacerbating malnutrition, with estimates of up to 132 million additional people malnourished as a result. Young child wasting, commensurate with that, is projected to be increasing by 14 to 15%. And yesterday, I listened to a briefing from the World Food Program pointing to 20 country food insecurity hotspots, and 4 among them where there are pending famine situations. Another participant put in the chat box, the issue of the growing urgency of obesity as well. This is all to say that this technical alliance is going to be very busy in the coming months and years. And I believe that today we are at the beginning of an initiative that is going to rapidly grow. Up until this moment, field practitioners all over the world have leveraged informal networks to get urgent help, sometimes successfully, sometimes not. Well, every practitioner requires a professional network that provides evidence and consensus-based standards. And they need a network that is consistent, reliable, timely, and which offers quality assistance. The statistics shared by Tanya earlier, reflecting the uptake of the Alliance's COVID recommendations, is a very positive sign of the vast need to be addressed and the willingness to engage this mechanism. The truth of the matter is that there simply isn't enough nutritionist human resource capacity in the world, and especially in the places that need it most. That means we really need to be on top of our game, all of us, taking every opportunity to support each other and maximizing the resources that we have at hand. I'd like to thank UNICEF for your catalytic investment in the Technical Alliance and your leadership and championship of child nutrition, which has been very consistent. I'm thankful also to the Emergency Nutrition Network and the International Medical Corps for assuming instrumental responsibilities in carrying this initiative forward, and to all of the 20 founding partners for your commitments to combating malnutrition. On behalf of World Vision, I can say that it has been a privilege to co-chair the movement through this founding stage, and that we greatly look forward to continuing to co-chair and support the effort in the coming 3 years at least. This is a very clear and compelling mission. We must collectively make this alliance work, as Victor had said at the beginning of our program today, and to advance the nutrition cause. So thank you to all of you. This is a very exciting day and moment, and I, amongst all of us here, I'm sure, greatly look forward to seeing this very well-constructed platform move forward and make a difference for malnutrition for children all over the world. Thank you.
Thanks very much, Dan. So that takes us to the end of our time together. We are at the top of the hour. Again, I just want to reiterate my thanks to all of you who have joined us. I'd like to thank each of those who shared today with us, particularly Victor and Dan, our colleagues from the DRC, and as well as my GNC Alliance team. Thank you for your inputs, and just want to acknowledge as we close that none of this would be possible without funding and support. And so here is a snapshot of the agencies that have been with us and allowed this work to move ahead. Thank you very much, everyone, and we hope to see you and hope to engage with you and look forward to working with you. Bye for now.